Welcome, everyone. I'm Dr. Carolin Klein, Programs Officer for STAR, back with another STARburst interview. If you're new to STAR or the first time watching a STARburst interview, STARburst interviews are designed to help us to get to know one another as STAR members, to stay up to date on new research, clinical practice, and learn from the professional wisdom of our members, and to continue to foster professional connections. I am absolutely thrilled today to have Dr. Bonnie Sachs joining us for this interview from Tampa, Florida. Many of you will already know Dr. Sachs. She has been a member of STAR for many years. We were just talking before hitting record that it's at least since the year 2000, maybe even longer. And Dr. Sachs served as STAR President from 2007 to 2009. But Dr. Sachs has also been doing extensive work in this field for many years. She is a clinical professor of psychiatry at the University of South Florida in Tampa. And until recently, before her retirement, she was working in a very busy private practice for many years conducting sex therapy. She also co-founded and ran a clinic for transgender folk, and she was a founding fellow of the American Board of Sexology. I am so thrilled that she agreed to do this interview. As a quick little side story, when I reached out to her to ask her if she'd be willing to answer some of my questions, she was so humble and she said, I think it's important to pass the torch on to newer members and people doing some really cool current research. And while I agree with her, I also think it is so important that we learn from people who've been working in this field for so long. And I know for myself, I often have this intimidation at conferences that I don't want to bother people that I've respected and looked up to for years. And so I'm guessing that other people may sometimes feel timid to approach people like Dr. Sachs. And so I'm going to jump in here and ask the questions that I know I would want to ask if I was feeling intimidated at a conference. And I'm just so thankful again, Dr. Sachs, that you're willing to speak with me today. Welcome.
Thank you.
All right. I wonder if we can start out. One of the questions I wanted to ask you is that you have been in this field for a long, long time, and you've seen a lot of change happen. Examples might be the HIV, AIDS epidemic, might be the Me Too movement, might be pornography, internet pornography, online dating. I mean, there's so many examples I could give. And I'm wondering if you can just share some of your reflections on what has it been like for you as a sex therapist going through these changes? Anything in particular that has stood out to you?
Sure, Carolyn, and thank you for that question. Your questions are so thoughtful. I think for me, the Me Too movement has given validation to so many people who've been ignored, not believed, unsupported for so many years. I saw so many patients, especially women, traumatized by sexual abuse, a number even with dissociative identity disorder. I also did, as you mentioned, have had a transgender clinic, and and the clinic was for many years. I also had a sexually compulsive men's group for many years. I lectured to medical students who years ago would walk out on lectures when I mentioned homosexuality or showed Walter Bachting's transgender story films. Medical students have evolved through the years into groups that are more progressive even than I am. I have also seen, though, a backlash in Florida politics that have targeted some of these most vulnerable groups. At the same time, I love the new research on sexual positivity. I remember when Eli Coleman announced that WAS was changing its name to the World Association for Sexual Health instead of sexual dysfunction.
Hmm.
And I really am impressed with Dr. Marie-Michelle Paquette's work on sexual satisfaction globally. Hooray for that.
Thank you. That is like super interesting. Yes, people walking out, I can imagine it. And it feels again like really startling to think of what it used to be like, and yet how far we still have to go and how much is still changing in sometimes scary ways right now.
Right.
Thank you. Speaking of societal changes, you were in the second year that women were admitted to Yale's OBGYN fellowship program. And I'm curious, like, how significant did that feel to you at the time?
Well, it was tough. It was very sexist going into that program. They were not so nice. We couldn't sleep in the residence quarters. We had to sleep with the nurses who also weren't very happy with us. But I had enjoyed a lot of adventures previously, and I was pretty tough, as were most of the women. Um, Inspired by my grandmother, who came herself from Russia when she was 16, I traveled by myself when I was 16 to Chile to see her cousins who only spoke Hebrew and Spanish. And I went to Costa Rica after my first year at Brown with the Peace Corps. And I went to Afghanistan with two hematologists when I was in medical school. And we went with Care Medico. That was before everything. The OBGYN program was, as I said, very difficult, but it didn't deter me.
Yeah, that's what I was just taking from it. And I'm curious, like, how much did that influence further risk taking in your life? Or do you feel that that was always in your character to be willing to take those risks?
Yeah, I think it did toughen me up a bit. There was one person tougher than me, my friend Mary Jane Minkin, who I knew from college. We were in the Brown together, and Mary Jane has a great website called Madam Ovary. I think everybody should look at that. She's terrific. And she's still at Yale, full professor and writing books and doing everything. So there were a couple tough people. Mary Lake Poland, who went to Africa and did a lot of vaginal rectal surgery there. And um, yeah, she was chair of OBGYN at Stanford after that. So there were a couple really tough cookies. But I followed right behind them and with them. So, I'm not too ashamed to be with that group.
Wow. Well, if I can say, speaking of tough cookies, I don't know how many people watching this interview might know, but you really had a change in your original career path. And if you're willing to speak to it, because originally psychiatry was not the path you were planning to take. And I'm curious if you're willing to speak to what happened in whatever detail you're comfortable, but even more importantly, advice you might have for others when huge things come up that are forcing us to change our career path in some way.
Sure. Well, I'm telling you, therapy helps, which I didn't have as much respect for as I did after this accident. I had a crush injury of my left arm, and I was left-handed, so I had to learn to write with my right hand, and of course, surgery was out. So that was the end of my OB/GYN career, although I kind of bridged it by doing psychosomatic medicine, and I didn't really lose a year. It was helpful to remember what I was grateful for. And I was happy that I had some control convincing the surgeons, because I said, look, I have median nerve function. Don't amputate. And they didn't amputate my arm. So I still have my left arm. So I appreciate that. And I had a great therapist, Jay Katz at Yale, and he helped me remember, so to speak, that I hadn't lost my arm. I told him I was a little hesitant with the male therapist. I said, I don't want to hear about penis envy. And he said, Bonnie, it's not just that you want a penis, it's just that you want everything. So that was very helpful, actually. And I was thrilled to get into Yale's psychiatry residency. I had a lot of great mentors, Ruth List, and other people who really were in my corner. And Phil and his wife, Lorna Sorrell, he was an OBGYN professor and she was at MSW. They were one of the first 7 people trained by Masters and Johnson. And they started an NIMH program in sex therapy. And I said, that's for me. That's a perfect bridge for all my training. I won't lose everything. So I really enjoyed that. As to others, I would say reflect on what are your strengths your interests, and your purpose. It's really important to have purpose. And what are your opportunities?
Thank you. Beautifully said. Beautifully said. STAR's membership, I think, over the decades has changed the ratio of men to women, and of course, now recognizing non-binary folk as well. And I'm curious, as a woman, was it ever a struggle for you with balancing career, family life, personal interests? And if so, how did you navigate that, especially in earlier times where there may have been huge pressure on you to either prioritize one or the other?
Yeah, I was very driven. And it was kind of ridiculous. I worked Fridays and had my two sons a year apart on my birthday on the weekends. And I said, no episiotomy because I'm flying to Tampa the next week and I have to sit for my psychiatry boards. So I did that, and I just had to get up because my breasts were killing me because I was still nursing. And so I got up very soon, and they said, "You can't get up. You can't finish. You have to finish. It's a 6-hour exam." I said, "No, I have more important things to do." And I had to pump my breasts, and I did pass my exams. So that was great. But I don't think people have to be that tough on themselves. I think that you don't have to prove yourself every minute, which I learned later on, and guilt is not useful. So when my younger son was in kindergarten, he said to me, "Mom, you get an A as a doctor and a B plus as a mom. Sometimes it's okay to get a B plus." So I learned that from my kindergarten son.
What a wise little comment. I love it. I love it. And for those who are in the more latter stages of their career, you have since retired from clinical practice. And I'm curious how you knew when it was the right time to retire and how you feel about that. Are there elements that you found out afterwards you really miss and have had to somehow bring back into your life in a different way?
I don't miss it. But I didn't think I could ever retire because I had 3,500 patients. I had 3 nurse practitioners and 3 therapists. But I eventually went by myself in that practice. I stopped taking insurance. I cut my hours. And luckily for me, a friend of mine who just left being chief of psychiatry at a hospital and went into private practice, I called her right away and said, "Jamie, will you take my patients?" And she said, "Only the very good ones." So I told all of my patients to say, "I am one of Dr. Sax's very good patients." So that was like the 646 patients I had left, although she didn't take all of them. So I had to find, it was impossible to get them into the university. It was a year-long waiting list. This country is really not, doesn't have enough psychiatrists. I sent them to some therapists and nurse practitioners, and it took me about 7 months to make sure everybody was in a good spot. I still get some calls from patients, but I did my very best to make sure everybody had a good place to land. It
Yeah.
was a little bit, it was a little hard. Um,
Mm.
I think that it's very important to have self-care. I always told patients, you're like a well. If you empty the well, you can't give your last drop or the well would crack. You have to take care of yourself. I didn't always follow that advice, but I try, maybe better when I'm retired. I love to exercise, and we walk every day and swim every day that it's hot in Florida. And I have lots of community groups. I'm just in 4 book clubs and lots of walking groups and all kinds of communities. And several boards. It's important not to commit to too many boards or too many activities because then you're just going to get tapped out. And I still lecture to various groups. I think STAR is one of my still valued communities because it really keeps me up to date, and I still lecture occasionally to different groups. So I appreciate STAR.
I think the feeling's mutual. Um, Watching the next generation of sex therapists and researchers building their careers, is there any advice, professional wisdom you do want to pass on? Anything that you feel that maybe is being lost over the decades where you would encourage some of the younger generation to not let go of things that were really valuable to you in your profession?
Well, I think one of strengths is the conviviality, the cross-cultural, cross um, pictures that people have, and I would really say advise people to keep their eye on the big picture, and especially education. I think we really don't educate enough people about sex therapy and the community to really see what communities you can get support from and you can give support to. I really do miss that there's not more integration with medicine. And because medications and medical illnesses really do play a part in sexual function. So I'd like to bring that back in.
Yes, yes. You have been a part of STAR for a long time. And again, as I mentioned in the introduction, you've served as president. Many of the new members of STAR aren't really going to have a lot of knowledge of STAR's history and beginnings, how it's evolved over time. And so I'm curious if you're willing to share a little bit some of your reflections on how you have seen STAR evolve. And I think you just answered it, but I'll still see if there's anything else you want to add. Anything else where you have a hope for STAR over the coming years?
Yeah. I do have a hope for more education that STAR is more involved with really training therapists and training other doctors and training, really having more education in general.
Mhm.
I think I'm very happy that there's more diversity in STAR. It used to be all cis white males. And it was hard even for the women to have a voice, let alone in the non-binary people and LGBTQ people. Even though we were supportive of them, they weren't really involved with STAR until recently. So I really do appreciate that evolution.
Yeah, wonderful. My final question before we do our lightning round of fun question is, I'm curious how you define professional success and whether this definition has changed for you over time.
Yeah, that's a great question. And it certainly has changed for me. So I don't feel professional success is as much reaching the status of full professor or society president. I feel successful when a patient from 40 years ago says, Dr. Sachs, you saved our marriage and we're still great. And I feel successful when I go to a school board meeting now, and which I would never have time to do while I was working. But I go to the school board meeting, and after they've received 3,000 signatures to eliminate sex education from high school, I can speak for 3 minutes about 80 studies that shows that sex education decreases STIs, unwanted pregnancies, and bullying, and they vote to continue sex education in high school.
Hmm.
And I feel successful when I see STAR thriving. So congratulations to all of you.
Thank you so much for those incredible answers. I really enjoyed hearing them. And I'm just, again, really, really thankful that we have people like yourself who've been a part of STAR for so long, willing to pass on some of your own experiences and wisdom. I'd love to end this, as we always do within a Starburst interview, with a quick little lightning round of fun questions where we just get to learn a little bit more about you. Maybe even some of those who've known you for a long time are going to learn something new and interesting. So if you are ready, Dr. Sachs, I'm going to put a minute here on the clock, although never a worry if it goes a little bit over. And here we go. Are you ready?
Ready.
All right. If you threw away all humbleness, what are you most proud of yourself for, personally or professionally, when you look back on your life to date?
I am just really satisfied. I am proud that I am grateful and lucky that I found my second husband by putting an ad in to say I wanted someone emotionally, financially, and sexually secure. And really, I found him, and he's the greatest.
I love that answer. If you were in a diner and there was a jukebox and you put money in it, what song would you pick?
Wow. Oh gosh, I would pick something by Taylor Swift.
I love that answer as well. You have been at STAR conferences many, many times. If you were to right now randomly pick one person who's super fun to hang out with at the conference, who's hopefully going to make it to Vancouver for this next conference, who's someone super fun that everyone should have the courage to invite for a drink?
Oh, gee, I love Ursula Hoffman. She came to my 25th wedding anniversary uh, from Ireland, but she may be back in Ireland now. I don't know. I always liked hanging around with her. And of course, Esther Perel, if she could come, I love her.
Love those answers as well. Final question I'm going to ask you. Over the decades, STAR has also lost some members. Is there anyone you really think we need to keep in mind, continue to honor that you really miss?
Oh, gosh. I miss Sandy Lieblum. She was a very close friend, and I miss her terribly. She had her stroke while she was in the Berkshires, which was my home, my summer home, and I was close to her. I miss her very much.
Dr. Sachs, thank you from me, from all of the STAR members, for all of your contributions to STAR all these years, all your ongoing support. Everyone, by the time you see this interview, we will be a few weeks away from the next annual conference in May in Vancouver, and I'm excited to share that Dr. Sachs is going to be here in Vancouver with us. I'm excited to see you then. So huge thanks to all of you. Thank you for watching. And as always, if you would like to be a part of STARburst, or if you would like to recommend someone else, if you have burning questions you'd like me to ask someone, please contact me, info@starnet.org, Dr. Carolin Klein, and I will be so happy to showcase you and your work. Wishing you all, hopefully just a good few weeks until we hopefully see you in Vancouver in May. Otherwise, wishing you a great month until the next STARburst interview comes out. Thank you so much, Dr. Sachs. Goodbye, everyone.
Thank you.